Welcome to Patient Safety Lecture Series 02. In this session, we'll focus on pediatric fall risk assessment using the Humpty Dumpty Fall Scale. Preventing falls is not only essential in adult care, it's also a priority in pediatric safety. By the end of this lecture, you'll be able to 1. Understand the importance of pediatric fall prevention. 2. Identify the 6 factors included in the Humpty Dumpty Fall Scale. 3. Accurately score and classify a child's fall risk. 4. Implement age-appropriate interventions. And 5. Differentiate pediatric from adult fall risk characteristics. Falls in children happen for very different reasons than in adults. They're often curious, impulsive, and unaware of danger. Combine that with 4 lines, unfamiliar surroundings, and medications, and you have a high fall risk environment. That's why a pediatric-specific tool like HDFS is needed. The Humpty Dumpty Fall Scale was designed to assess fall risk in children from infancy through adolescence. It uses 7 key criteria to determine risk. The total score helps guide the level of fall precautions needed. The Humpty Dumpty Fall Scale uses 7 risk factors to assess pediatric fall risk. These factors are tailored to children's unique developmental and medical profiles. Higher scores indicate a greater likelihood of falls, helping us decide on the appropriate level of fall prevention interventions. After scoring all 6 items, a total score of 12 or more classifies the child as high risk. Any score below 12 is low risk. Based on the result, you apply the correct level of fall prevention interventions. Age. Younger children are at higher risk because of poor coordination, impulsivity, and lack of awareness of danger. The scale gives the highest points to infants and toddlers under 3 years, while teens above 13 are given the lowest score. Gender. Studies have shown that boys tend to engage in more physically active and risk-taking behaviors. This is why male patients are given a higher score on the HDFS. Diagnosis plays a significant role in pediatric fall risk. Neurological conditions such as seizures or cerebral palsy carry the highest risk. Respiratory problems, dehydration, anemia, or dizziness also increase risk. Psych/behavioral issues and other diagnoses carry lower, but still notable risk. Children who are unaware of their limitations are most likely to engage in unsafe behavior, scoring 3 points. Those who simply forget still pose a risk. Children who are aware of their abilities have the lowest fall risk score. Environmental factors include not just where the child is, but also their history. A child with a history of falls or a toddler placed in an unsafe environment scores highest. Crowded rooms or use of devices increase risk. Being in bed or outpatient areas pose the least risk. Children within 24 hours post-surgery are at the highest risk due to residual anesthesia and pain medication effects. This risk decreases after 48 hours, but must still be monitored. Medications such as sedatives, hypnotics, barbiturates, and narcotics can impair motor function, balance, and cognition, dramatically raising fall risk. Multiple medications compound this effect. If a child is high risk, implement full fall precautions. Keep the bed low with side rails up, lock all equipment, and use visual cues. Ensure the family understands their role in keeping the child safe, especially during ambulation or play. Let's apply what we've learned. Here's a case. Miguel is a 5-year-old boy admitted for pneumonia. He's known to be impulsive, has a prior fall history, and is currently in a crib on oxygen. He has not undergone surgery, but is on nebulized medications. Let's compute his Humpty Dumpty Fall score. Based on Miguel's profile, we compute the following. Age 3 points. Gender 2 points. Diagnosis 3 points. Cognitive status 2 points. Environment 4 points. Surgery 1 point. Médication usage 1 point. His total score is 16 points, placing him in the high-risk category for falls. For Miguel, implement full fall prevention protocols. Use signage and wristbands, ensure crib rails are raised, secure all tubing and devices, and maintain constant supervision. Educate his family about the risks and ways they can assist. Offer safe toys to minimize the urge to climb or move unsafely. Regular safety rounding is also critical. Thank you for your attention. To complete this session, kindly answer the post-lecture quiz by scanning the QR code or accessing the link provided. This helps ensure proper understanding and consistent practice across all shifts.